Just I have a seminar, madam. Would you mind? Would you? Anil, can we start?
Yes, sir. 1 minute, sir. Yeah.
Okay.
Sir,
Yeah,
yeah,
can you
you can
hear me?
start. Yeah, I can hear you, sir. And you can start now, sir. It's time
Okay,
11.
let
Yeah, please stop.
let the students assemble. I think they are in the corridors. Let the students assemble.
Okay, sir.
Yeah, somebody has to tell them.
Okay, sir. So they are third year and final year students, so they have labs now. More they are going. You can
Okay,
please start, sir. Already second year
okay,
students are in the
okay,
class only.
okay.
Yeah, good evening to all. Today, Professor P.B. Kavikishore sir will deliver lecture on human genome sequence and its succor in designing personal or stratified medicine. Sir, please start, sir.
Yeah, yeah. Last time, we have discussed about a couple of weeks ago. We have discussed about the human genome sequence, and how it has helped us, to find out the single nucleotide polymorphisms. So, or the DNA sequence variations. How this DNA sequence variation from human to human is helping us in better healthcare. That is the essence of today's talk. So, yeah. Um, what are the actual benefits or the practical benefits of learning about the human genome sequence? Huh? Okay. Okay, okay, okay. Anil, it seems there is some problem with the internet here. Okay, okay, okay. There is some problem with the link, Dr. Anil. Anil, can you hear me?
Yes, sir, I can hear you, sir. No, sir, there is
Yeah,
no
yeah.
problem with the link, sir. Many of them are joining.
Yeah, let them join. I think couple of minutes we have to wait. I have received the message that students are not able to join because there is some problem with the link.
No, sir, already 24 participants has joined.
Anyway, we'll wait couple of minutes, Anil.
Okay, sir. Okay.
Fabulous.
It's okay. Shall we start now?
Yes, sir, you can start, sir. More than 50 members, already 80 members has joined, sir. Some are there in
Okay.
the classrooms. Yeah, please start, sir.
Yeah, yeah. So last time we have discussed about human genome sequence, how it can help us in personalized medicine or stratified medicine. So the DNA sequence variations can help us in diagnosing a particular disease or disorder, and also to treat a particular disease. And someday we are hopeful of preventing such diseases or genetic disorders uh, over a period of time. So, personalized medicine, that is the new mantra now in healthcare. So, if you harness each person's, clinical, genetic, genomic, and environmental information, that can drive the concept. That drives the concept actually. So, how to take the genetic information or genomic information? Unless you sequence a particular human beings, the genome, we will not be able to trace out where the DNA is going wrong or where the DNA is going right. So that helps us in treating a particular person better. So that is the simple idea. So we can maximize a patient's chances of survival once if you know the genome sequences, because we can administer better drugs, or the drugs that can suit to that particular person. So that is the whole concept here. So what is the goal of personalized medicine? The goal of personalized medicine is to improve the treatment outcome. So suppose, if you are treating a particular person, say, let us say a person who is suffering from breast cancer, if you treat that particular person with any drug that you feel like, I mean, associated with breast cancer only, so that can never be treated. So the outcome would be zero. So first of all, we need to sequence that particular tumor. And then, based on that particular genome sequence, we need to treat that particular person. So that is the essence here. So according to the Personalized Medicine Coalition in Washington, there were only 13 examples of personalized medicine for diagnostic as diagnostic biomarkers, as early as in the year 2006. So that number has reached to 72 by the year 2011, and more than 120 personalized medicines are there with the approval of FDA by the year 2019. So in other words, what I'm trying to tell you is, the personalized medicine and also the discovery of the new medicines is increasing day after day. So what is that you get? If you come to know about your genome sequence, what is that you would come to know? How it is helping in a better healthcare. Suppose if you have the knowledge of elevated risk of risks, for known diseases, that can help you in taking proactive decisions about your health. For example, you can visit the doctor more frequently for checkups. You can choose one type of prescription or that of another drug, and also you can alter your diet plan or exercise plan. You can also inform your wife or your parents regarding the reproductive decisions. So these are some of the practical benefits if you come to know about your genome sequence and also its variations. So it is important all the more for us to find out so where the DNA is going wrong in our genome and where it is going right. So, for example, people with shared genetic variations and mutations, they are now sharing their views. For example, using the Facebook, they are sharing their views. And then they seek the support from others. For example, Facebook is now hosting several groups. Several people join there. I mean, who are suffering from the same disease, they join there and then they try to discuss, several problems that are associated with a particular disease or a disorder. For example, in the case of Huntington's disease, there is a specific group in the Facebook. They discuss about the problems that they are facing. So Huntington disease is associated with nervous disorder. Similarly, people who are suffering from breast cancer with BRCA mutations, they also have a group and they discuss there, including the other problems also not only associated with breast cancer, or it also other problems. Similarly, for macular degeneration or blindness. And then, what are the unintended consequences of this human genome sequence? If you come to know about the human genome sequence, some privacy is necessary. What sort of privacy is necessary when we know the human genome? What are the unintended consequences of this particular genome sequence? For example, if somebody steals the database, that contains your personalized genome sequence, and if if that fellow can predict, what is going to go wrong. I'm sorry, what is going to go wrong or what is going to go right. So he would come to know about that one. So he can inform the health insurance or the people who are associated with employment. He can inform about your health conditions, or he can predict and then tell them. So and so is going to get cancer, or so and so is going to get diabetes, or so and so going to get heart attack and all that. In such a case, nobody will give you health insurance, or nobody would employ you if they come to know that I am going to die tomorrow. So these are some of the unintended consequences. So some privacy is necessary. So that is the bad part of human genome sequence. So earlier people used to discriminate based on certain things, but now the day has come, they'll start discriminating you based on your DNA. So there is a fear that information about your healthcare needs may affect your ability to find employment or insurance. So America has now enact what we call as GINA, that is GINA, that is Genetic Information Non-Discrimination Act. No one can discriminate, should discriminate. No one should discriminate based on your genomic information or DNA information. That is forbidden in the case of America. That law is necessary for almost all countries because this, this sort of personalized medicine is now increasing day after day. The hope is that GENA will not only prevent genetic discrimination but also encourage greater participation in medical research. Similarly, we have, if you come to know if you know the genome sequence, we will have certain advantages. For example, pre-implementation genetic diagnosis. Now, take for example the procedure known as pre-implementation genetic disorder or diagnosis. I'm sorry. So your embryos that are created via in vitro fertilization can now be tested for a number of genetic traits. So the results can help prospective parents to choose which embryo to be implanted, or in a mother's womb or a woman's uterus, or which embryo should not be implanted. So this can help thousands of children as well as the parents. So what is important here is, several parents will get benefited if they come to know that the child who is going to take birth, if he is going to be healthy or if he is not going to be healthy. So this sort of information is necessary for us in advance so that we can take certain reproductive decisions. So suppose if you come to know that the child is going to take place, going to take birth and with fatal diseases, then we can get it aborted with the help of doctors, of course. So this sort of information can be a comfort for the parents as well as for the newly born baby in certain cases where the child health is very, very good, or it can also a source of worry for them and also their child in other situations. So the human genome project sequencing is certainly helping in improving our human health care. So once upon a time, it has costed millions of dollars to sequence a particular genome of a human. But today, you can sequence that one for $400, maybe $500, or $300 in course of time. Or it may come down to $100 in few days. Therefore, it can help us. So this means to say that genome analysis is now in the cost range of a sophisticated medical test. Certainly, it is going to help us. And doctors can use your DNA sequence analysis just for diagnosis. I'm sorry. Just for diagnosis, and they can help you to treat better, especially for the mysterious neurodevelopmental disorders or mitochondrial diseases. They can diagnose better with the help of DNA sequence analysis, and then they can go for personalized medicine. In such a case, genomic analysis can identify diseases that can with variations or mutations at least in 19 to 30% of the time. So this human genome project is certainly going to help the doctors to treat individuals with the better health care. And then genomics is probably going to make its biggest strides in cancer therapy, So doctors can now sequence a particular patient's tumor to identify certain DNA disorders or DNA variations, and based on the DNA variation, one can, the doctor can administer the drug and treat the patient and go for therapeutic interventions. Specific drug targets may be found in as many as 70% of the tumors. So, in other words, the human genome sequencing is very, very essential before we treat a particular patient. So, instead of taking, amniotic fluid, which is invasive, so people are now trying to take blood, and from the blood we can sequence the whole genome, and then we'll come to know about certain DNA sequences that are going wrong in our body. So we can take today a blood sample and then try to inform the doctor, and also the doctor can take better care of the patient. So we know today more than 5,000 genetic disorders, and these, earlier these many disorders were not known. So the disorders were very few earlier, but because of the human genome sequence, we have come to know that there are nearly 5,000 genetic disorders. And more than 100 different federal drug administration approved drugs are now available in the market, which have been packaged with information about the DNA sequences. So this tells the doctors to test their patients, for genetic variations, and accordingly administer the drug. So without administering the drug, the doctors should not administer without knowing the genetic information. They should not administer the drug. So of course, in India, most of the clinicians or physicians, they don't study molecular genetics or molecular biology, especially the genome sequences and their variations. So that is where the problem comes. But as bioinformaticians, as the biotechnologists, you can help the doctor by sequencing the particular DNA of a human, and also by predicting certain things or variations in the particular DNA. You can inform a particular clinician regarding the human genome sequence variations. That only can help the doctor to administer a particular drug. I'll try to give few examples here how personalized drug is helping the patients. For example, in the case of breast cancer, you cannot administer all drugs, or for example trastuzumab or Herceptin drug for those patients who are negative also. So there are two different types of, or many different types of breast cancer tumors. So first of all, we need to test whether in a particular tumor is Herceptin positive or Herceptin negative. Based on that one, we can give the drug trastuzumab, or the doctor can prescribe the drug trastuzumab. There is no point in administering the trastuzumab drug for all the patients who are positive or negative, or both of them. So it works only where the tumor is HER2 positive. It would not work in those patients where the tumor is HER2 negative. Similarly, studies also have found that lung cancer patients have tumors, and these tumors are, if they are positive for epidermal growth factor receptor or EGFR, what we call, then they can respond to the drug, geftinib. So that, the patients would not respond to the geftinib or erlotinib where EGFR, that is epidermal growth factor receptor mutation, is not there. If that particular mutation is there, then only the drug would work well. That is geftinib or erlotinib would work well. So we need to target a particular mutation. Based on the a mutation, we need to administer the drug. Similarly, we have anaplastic lymphoma kinase, what we call as ALK. This is a gene that tells your body how to make proteins that help cells to talk about each other. But it has been found that ALK or anaplastic lymphoma kinase mutations also occur in the humans. So if you have lung cancer with an ALK rearrangement, part of this genome is broken, or the gene is broken and attached to another gene. So in such a case, so doctors cannot administer any drug that they feel like. First of all, they have to test whether ALK is mutated or whether it is normal. So today, the US Food Drug Administration approved, a drug called uh, capmatinib. This capmatinib would work for the treatment of adult patients with non-small lung cancer. So that has spread to other parts of the body also. So this drug would not work where a particular mutation or DNA variation is not there. In other words, genome sequencing is very, very important before we administer the drug. Similarly, cetuximab, it will not be effective in patients with a mutation in a gene called KRAS, that is Creston rat sarcoma viral oncogene. So that affects the colon cancer. The determining the presence of a specific genomic variation is very, very important. For example, colon cancer patients whose tumors have a mutation in a gene called Creston rat sarcoma viral oncogene, they derive very little benefit from the drug, cetuximab and also panitumumab. So these two are very, very important drugs for those patients who are suffering from the colon cancer. So if this variation is not there in this particular colon cancer, these drugs will not work. So in 1993, when the human project has begun, human genome sequencing has begun, there were only 53 genes that have been shown to cause diseases. But today we have more than 2,900 genetic gene variations. And similarly, in the case of in the case of a rare endocrine or thyroid or pancreatic cancer, so we have, in this particular cancer, novel genetic alterations have been, detected. In adenocortical carcinoma or cancer in the adrenal glands, researchers have found extensively, they have extensively analyzed many cases and found some variations. They found that whole genome doubling is there in certain cases. So, similarly, not only whole genome doubling, but also extra sets of chromosomes have been observed. So, unless we come to know about these extra sets of chromosomes or whole genome doubling, we cannot treat the particular patient who is suffering from this endocrine disorder or cancer or thyroid or pancreatic cancer. So chromosome number alteration plays a critical role in determining this particular carcinoma. So it is very, very important for us to find out whether the patients are suffering from any such disorders, chromosomal abnormalities. So improved understanding of the genetic, drivers of the papillary renal cell carcinoma or kidney cancer is also one of the important diseases. And there are two different types of kidney cancers here. In the case of type 1 kidney cancer, usually that is characterized by a mutation in the signaling pathway, that is mesenchymal epithelial transition factor pathway. So this MET gene or mesenchymal epithelial transition factor gene, which is known to drive the cancer here, kidney cancer, is very, very important. And we need to treat that one with a specific drug once if you discover that it is a type 1 kidney cancer. So MET gene mutation or other alterations that affect the kidney cancer or type 1 kidney cancer. So we need to treat that one with a specific drug, as I said. So inhibitors of this MET gene mutation are very, very important. These genes, for example, ferrotinib can inhibit this MET gene pathway. So which is very, very currently being tested, and also it is in the clinical trials. So such discoveries are very, very important for us. Whereas in the case of type 2 kidney cancer, what is important is here what they have discovered is a CpG island, so which is methylated or methylated. So in the case of this particular tumor, we have methylated phenotype, which has been found almost exclusively in type 2 kidney cancer. So this this biomarker or CAMP biomarker, it is important for us to diagnose this particular kidney cancer. It's a type 2 kidney cancer. We need to distinguish between type 1 and type 2. That can be done only when you have a biomarker. So if you don't have a biomarker, we cannot distinguish between these two. So therefore, it is important for us to see whether it is type 1 or type 2. Accordingly, we can administer the drug. So in the case of chronic myeloid leukemia and melanoma, people have been using Gleevec. So this Gleevec is used to treat, chronic myeloid leukemia, which has increased life expectancy from 5% to 95%. So just imagine, without, genome sequencing, we would have been nowhere. And, the survival rate was only 5%. Now it has improved to 95%. The survival rate has been improved to 95% just because, they have sequenced the entire tumor of this particular leukemia. So similarly, Zelboraf, it is used to treat melanoma or skin cancer, where the late stage prognosis has been dismal. But 60% of the patients today, if they have a defect in their DNA, and this drug works very good. So especially the biomarker V600E, so that has been discovered. So this defect in this particular DNA, once if you detect, you can treat the this particular disorder very well. So in other words, what is important is, finding out the defects, in the particular DNA. So finding out the defects in this particular DNA, in a particular DNA of a tumor is very, very important, and we can accordingly discover a drug, and also we can go for treatment. Similarly, we have personalized neurology, or personalized medicines for neurotic disorders. For example, biomarkers have been found for Alzheimer's disease, ApoE2 or ApoE4, and people have been trying to discover a particular drug. So in the case of neurology, finding a particular drug for I'm not sure why, but finding a particular drug appears to be very, very difficult. But why it is difficult, I'm not sure at the moment. But what I have read is it is not going to be easy to find a drug, especially for neurological disorders. And similarly for Parkinson's, the biomarkers have been identified. The drug is, they are trying to develop a drug for Parkinson also based on that particular biomarker. So we have general drugs, but based on the biomarkers, we need to develop drugs also. Similarly, for multiple sclerosis, interleukin 17 antibodies, biomarker has been identified, and people have been trying to develop a particular drug for multiple sclerosis also. And similarly for Parkinson basal ganglia, so we have certain disorder here in the case of patient. The clinical symptom is oscillatory frequencies, from subthalamic nucleus. So people have been, based on this particular symptom, people have been trying to develop a clinical therapy. I mean, the disorder, people have been trying to develop a particular clinical therapy. So we have personalized medicine in neurology. So in Parkinson disease, increased endogenous frequencies recorded from the subthalamic nucleus region have been associated with worsening of motor symptoms. So based on that one, people have been trying to develop a drug. So these specific oscillatory frequencies could be utilized to tailor a personalized approach to deep brain stimulations in the case of humans. So this can help a particular patient and also the doctors to treat this particular patient better. Now, we also not only have personalized drug administration, but also we have personalized dosing. What is important here is, the dosing. So this is, of course, personalized medicine and personalized dosing are not something, new, or it is not a new concept, all the more. So we have such personalized treatment or dosing in the case of homeopathy, for example. So based on, we cannot give the same type of, say for example, suppose if I am getting headache, headache can be at the back of my head or in front of my head, or right-sided headache or left-sided headache, or only at the top of my head. But in the case of, allopathy, what they do is simply they give some aspirin or some painkiller for all the patients. But they don't see whether the patient is getting right side headache or on the left-sided headache, or at the top of the headache, or at the back of the headache. For example, if you are getting a headache at the back of the head, usually in homeopathy we give acid nitric, that is nitric acid. So right-sided headache, we give, sanguinaria. Left-sided headache, we give laxus. Or at the top of the headache, in the top of the head, if you get headache, we give belladonna. So these are what we call as, personalized medicines. Such personalized medicines, are, of course, now the concept has come in allopathy. Similarly, personalized dose, whether we have to give only 10 milligrams or 20 milligrams or 500 milligrams, what is the dose, that can be decided now based on your DNA sequence analysis. So this personalized dosing is now very, very important. This personalized dosing is also there earlier in the case of homeopathy, for example. Of course, doctors, they take familial history, whether your parent, any of the patient's parent is also having this particular disease, or father's father or mother's father or mother's mother, any one of them is having this particular disease. Doctors, they usually take that information, what we call as familial history. But personally, when it comes to personalized dosing, so usually they say, okay, you take 1000 milligrams per day, but whether it is working or not, we do not know. So this dosing is important. There are successful examples of the prediction of correct personalized dosing. The best known example is, the CYP450 enzyme and its application to comodine or warfarin therapy. Warfarin is generally used for thinning of blood, or for it's an anti-blood coagulant, blood anticoagulant. So warfarin, is being used for as an for blood thinning. So the correct personalized dose of warfarin can now be determined based on your genome therapy, genome sequence. So it can prevent, if you give actual or correct personalized dosing of warfarin, that can prevent 17,000 strokes in the case of America, and avoid 40,000 patients, visits of these 40,000 patients to the emergency rooms. So in other words, correct dose is also important. It is as important as that of personalized medicine. So now what is important here is, the gene environment interaction. Last time, I have informed you that, you did not choose, Vijnan University, or you did not choose, biotechnology randomly. What you have done is, you have come to the Vijnan University along with your parents, and then are found out, whether Vijnan University is good or bad, what sort of, faculty are here at the Department of Biotechnology or in other departments, what sort of, canteen facilities do you have, or hostel facilities do you have, or health facilities do you have, or what sort of equipment that we have at the Department of Biotechnology, or what sort of infrastructure that we have. So that is what is called as environment. And this environment interacts with your DNA, and then only you decide whether to join Vijnan University or IIT Madras or IIT Mumbai or something else. So in other words, your DNA is interacting with the environment, at any time. That holds good, for selecting your wife or husband also. That holds good, for deciding, several things, in your life. So I'll give a small example of this one, because the time is going to, I have to wind up at 11:40. So I'll give one example here, which is very, very important, that everybody has to remember throughout their life. For example, children, if they have a low level of monoamine oxidase gene, that produces a protein called MAOA protein. So if the gene is not expressed very well, and if he is maltreated, then he is going to become an antisocial personality. Maltreatment means, here, suppose if you scold the child with the low amounts of MAOA protein, or if you treat him very badly, or if you beat him very badly, then he is going to become an antisocial personality. Here the gene is MAOA gene. The maltreatment is environment. But how environment, or if you beat a person, or if you maltreat a person, or if you scold a person, how he is going to become an antisocial personality is not known. The interaction, exact interaction between maltreatment and the gene is not known. But what is known is, if you maltreat a person with a low level of MAOA protein, certainly he is going to become an antisocial personality. On the other hand, a low level of MAOA polymorphism will not cause you to develop an antisocial personality if you don't maltreat that person. But at the same time, maltreatment does not affect children with a high level of MAOA polymorphism also. Or if the enzyme is produced in high concentrations, if you maltreat the particular child, he is not going to become an antisocial personality. What does it tell you? The information is that the gene and an environment, they interact with each other, and then a person is going to become an antisocial personality or not going to become an antisocial personality. So, in other words, what is important is, the gene environment interactions we need to take into consideration in several of these things, and especially in psychiatry. So, we need to take into consideration the gene environment interactions. So, that is very, very important. What is not vulnerable at the moment is, several of the psychiatric disorders where we don't have very poor medicines or no medicines. So we need to find out not only just genomic variations but also the environment into consideration, and then only you can have a better treatment for or you can go for better therapeutic interventions. So that is in the essence of my talk, and thank you all for giving me an opportunity. So I am open for any if you have any questions.
The session is open for questions. If you have any questions, please ask.
Any questions? Can you hear me?
Yes, sir, we can hear you.
Yeah. Any questions? Any questions, please, students?
Hello, sir.
Yeah, please.
Hello.
I hear
Good
you.
morning to everyone. Good morning to everyone. I'm Altaf Ahmed from Integral University, Lucknow. Sir, my question is that you have just talked about the genetic environment, that gene environment, and I want to know that what are the different factors that are present in the environment that interacts with DNA and leads to some specific mutation in different genes.
We do not know. We don't have much information how environment is going to influence the DNA. I just informed you that the selection of a particular college or a university is not random. Similarly, the selection of your wife or husband is not random. So the the DNA, and also your DNA interacts first of all with the environment there. Environment could
Yes,
be
sir.
anything. Environment could be as I have pointed out, it could be the infrastructure in a particular university, or it could be in the case of a university, or the research that is going on in a particular university, or in the case of selection of a particular a wife or husband, what you see is educational attainment. What is that
Yes.
that my wife has studied? Is she did she study MSc or MTech, or did she study MS or MD? Educational attainment, family background. So these are some of the environments that can interact with your DNA and then decide whether you are going to marry a particular person or not. So that how they interact with each other, I'm not sure at the moment. So that is we need to discover about that part. That is the toughest part.
Yes, sir. Actually, we know that the specific mutation, as we are dealing with the personality medicine, so that is very important. I think because we have different genomic variation, genomic setup in different persons, and
Right.
yes, sir. In different persons, there may be different environment. There may be different other factors in the environment that's surrounding the DNA, and it may be. Some different types of interactions there that may result in specific gene mutation.
Yeah,
So
right.
there is a need of
The best
there is a
example
need of
is smokers. smokers
Yes,
get,
sir.
cancer, lung cancer, and cancer, and then, the cigarette smoke, they interact with each other. Your DNA interacts with your cigarette smoke, and then he would get the lung cancer. But how, the cigarette smoke can cause in the lung cancer, that we need to discover. Similarly, people who are exposed to the asbestos, they also get, lung cancer. How
Yes,
asbestos
sir.
can, uh, interact with your DNA, and then, you would be susceptible. Of course, all smokers do not get lung cancer,
Yes, sir.
but others also they get. That means to say that, what is going right in a particular person
What?
who is not getting, lung cancer, and
Lung
what is
cancer.
going wrong at the level of DNA in a particular patient,
Patient who is not
who is
smoking.
suffering from smoking,
Non-smoker.
at the
Yes,
same
sir.
time, lung cancer. That we
Yes.
need to find out, and then only we can have some conclusions.
Thank you, sir. Thank you very much, sir.
Yeah.
Sir, thank you so much.
I'm not able to hear. Dr. Prashant, is it Dr. Prashant?
Uh, yes, sir. Thank you so much, sir, for an excellent talk. I have a small question. Can I ask you?
Yes, sir, please, please.
Yeah, yeah. Sir, I think single cell RNA-seq is making rounds towards precision therapy. I
Mhm.
mean, in case of MOEA and the kind of, CYP450 or coumadin or warfarin kind of examples that you have taken, maybe it could certainly help us understand what proportion of genes are probably differentially expressed in particular cells. Probably those particular cells, could really be targeted and enriched towards, drug response. So I think this has just really begun to be understood, because many single cell RNA-seq based technologies have made efforts towards gliomas or glioblastomas. But where do you see this coming up in India, sir? Where are we placed with respect to the funding, and as well as taking this to the layman or middleman? Yeah.
Yeah, yeah. Dr. Prashant, you know pretty well that funding with regard to the personalized medicine or human genome sequencing is very very little. People have just started, CCMB and others have just started, sequencing the human genomes of different, probably different races and all that. But we have just started. I think in India we are nowhere. I don't think that we have reached somewhere where we can start looking at variations that you are talking about, RNA-seq variations or any of differential gene expressions associated with any of these diseases or disorders. But that is I don't think that we have started yet. But what is important here is the statistical significance of a particular mutation, and a particular drug. Suppose if you discover a new drug for a particular mutation, statistically whether it is significant, how many people are, suppose if you have 100 patients, if you administer the drug to 100 people, is the drug is going to cure or alleviate the clinical symptoms in all the 100 people or not. So that sort of information we require, and that is very very important. I feel that is also important in addition to the in addition to the the information that you have provided. Yeah, Dr. Prashant.
Yeah. Thank you, sir. Thank you so much. Thank you, sir.
Any other question?
Excuse me, sir. Is
Yeah,
I
Dr.
audible, sir?
Sugunakar. Yeah, Dr. Sugunakar.
Yes. Namaskar, sir.
Namaste.
Thank you so much for giving more insights. So, being a person working in cancer genetics, from last from 2009, uh, I always wonder of thinking about this genetic variability that we talk about, especially with regard to xenobatic metabolism. So I basically work in xenobatic metabolism and trying to understand the CYP genes, especially the cytochrome P450
Yeah.
uh, family of enzymes. The most important is like CYP26, which plays a very pivotal role about this genetic variability.
Mm.
When we see in from different regions, from European, US, and Indian context, a person who, like you worked in protein metabolism pathway, do you see any of these metabolic indicates which might be affecting this?
Yeah, we have just started, analyzing the breast cancer patients, especially
Okay.
the protein metabolic pathway genes. We have taken
Okay.
just, only 63 patients, and we have not yet come to a conclusion at the moment, So it takes some more time for us, to get some conclusion.
Okay. 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 Thank you. Thank you so much, sir. Thank you.
Yeah. Any other question?
If there are no questions,
MTech and BTech and MTech students, I like to request them to ask some questions. Vijnan University, especially, a student should ask: do people follow, or is it Greek and Latin? Students, from Vijnan Biotechnology department, BTech and MTech students, do you people follow or you don't follow? Any problem? Of course, this is not a classroom talk, classroom lecture. In classroom, we explain better. Uh, but here, the time limit is there, only 40 minutes. So, do you have any questions?
okay. If there are no questions, sir, we would like to thank you for delivering a wonderful lecture and giving insights into personalized and stratified medicine. Thank you, sir. Thank you very much. Thank you for all the participants for patient listening. Thank you.
Thank you.